live shot at Hospital Row this morning. And thank you to everybody who's working inside there today. Because as we heard from you sound off earlier, I can't believe this is still ongoing. Our emergency rooms are in peril. And this should be at the top of everybody's news every single day. Just because you don't need it right now doesn't mean you won't later on today or somebody you love. This is unbelievable. There was a time when we were all terrified because there wasn't enough PPE at the beginning of the pandemic. And we should have been. But now you can't even get into the ER or scene or a bed. Like, this is staggering beyond staggering. And there are many people who left for a million reasons. Like you said, why are there signs that say, please treat hospital staff kindly? Why do we need signs? Arlene Dickinson actually tweeted this yesterday. And I was like, she's absolutely right. Why do we need to be reminded to be kind to the people that we spent many a night banging pots and pans saying frontline heroes, and then treating them so poorly? And guess what happens when you treat people poorly? They get burnt out and they leave.
See ya.
And here we sit.
Yep.
When is there going to be something done? Because, by the way, it's August. And right around the corner is fall, colder temps, predictions of another wave. Add that to the already congestion, the backlog. Oh my gosh, this is a mess.
It's a mess, but I want people to really pay attention to this, okay? Because we had an election in this province where everyone was a little too busy to show up. Everyone had something to do, or they were just lazy. And now we're in a spot where we have a provincial government in this province that doesn't feel they need to even address this in front of open press. Now, Premier Ford's going to be forced to do this today. Guarantee you 4 questions, tops. 4 questions before the PR person jumps in today. Tops. That's all you're getting. He'll talk about it just a little bit today. But remember this moment, because you and I have been talking about this now for like a week and a half. Mel's been on the story. Tammy Sutherland's been on the story. Richard Southern's been on the story. Remember this moment when no one did a damn thing. Our prime minister's in Costa Rica sunning himself. This is a national issue. Provinces deal with health. This is a national issue. Remember this moment, because in 10 days, we're going to have a big press conference where everyone's sitting there, Sylvia Jones, Premier Ford, and everyone's going to look real serious. And the way politicians typically come late to the party on this. This is happening in real time, okay? I don't care if you want a summer vacation. I don't care if you're tired. If you want another job, quit. This has to get dealt with now. I'm getting tired of this garbage. Every time something happens in this province / this country, people are MIA because they don't want to deal with the tough issues. If you run for public office, this is what we need you for. We don't need you telling me about a highway that's going to service 20 people. We don't need you having photo ops with world leaders like you're at a wedding reception. I need you now. I need you present. I need you in this moment. Because if I got family or you got family or you got family or anyone else here has family that needs something tonight, they're screwed. Okay? They are screwed. I know we want to start light. We want to have a good time. That is a joke. What happened last night. That is a joke what happened in this province over the weekend, and we're not screaming from the mountaintops on this.
ER's on the brink of closing, one after another, not just one single case because of one single incident. This is a continuing problem. We all stayed locked in our homes, stayed away from our families for the sake of preserving one another's health. We pride ourselves on our pristine healthcare system. There's been documentaries about it. Look at our friends to the north. Look what they do there. Right now, we're doing it all wrong. This is a catastrophe. This is lives, like you said, on the line. And the good people who are still working in the hospitals who are there for us, God bless them, they are burnt out, and it's inhumane to ask them to work 16 hours with not even time for a meal because they are needed. Something has got to give, and it cannot be at the cost of the Canadian lives who pay good tax money to make sure that we are seen when we need help. It's crazy.
Dia, I'm with you. I've heard politicians tell me for a long time, we got your back. I got your back. I need to see that now.